Welcome. I'm Jeff Brown, Executive Director of the Cannabis Regulatory Commission. Thank you for joining us to talk about this important issue, which is safe and smart use of cannabis. The CREAM Act, the legislation that paved the way for the legalization of cannabis in New Jersey, stipulates that the Commission provide information for safe and responsible consumption, as well as programs and campaigns to deter the underage, youth consumption. The launch of this campaign embodies our ongoing commitment to prioritize public health and safety, something we've done from day one and continue to do and expand with the launch of this campaign. Our primary goal with the Cannabis Safe use campaign is to provide the public with the information and resources needed to make informed decisions about cannabis consumption, and to make that information ubiquitous and accessible. The campaign will feature targeted digital ads in English and Spanish on social media, streaming platforms, out-of-home ads such as billboards, posters in hair salons, barbershops, and other locations. The Cannabis Safe use campaign has been designed to encompass several key components. Number one, education. We've developed factual, science-based material on cannabis, its effects, and potential risk for all, especially for some at-risk populations, highlighting the effects on children and teens, people who are pregnant or nursing, and those using prescription medicine. We're also highlighting the need to store cannabis safely so that some of the at-risk populations, like children, cannot get access to legal cannabis products. It also features community outreach. The campaign is statewide and aims to reach communities across New Jersey to ensure everyone can access information and the resources they need to navigate the legal cannabis landscape safely. We're going to be partnering with other agencies, nonprofits, and state agencies to amplify the campaign's message, some of which are represented here at the press conference. We're going to focus on regulation and enforcement. From day one, the CRC put in place some of the strongest and safest cannabis regulations in the country, and we're going to continue to uphold those rigorous rules outlined in the CREAM Act and in our regulations to ensure that cannabis products are tested, accurately labeled, packaged in safe packaging that reduce the likelihood of accidental ingestion by children and adults, and continue to be safe for those who choose to use them. The safe and responsible use of cannabis is not just a legal obligation, but a moral one. Our shared responsibility is to ensure that New Jersey remains a beacon of progress, equality, and social justice. Thank you. I'm going to now introduce Commissioner Nash. Commissioner Nash is a member of our Public Education and Engagement Committee. From day one, the Public Education and Engagement Committee, and particularly Commissioner Nash and Commissioner Barker, who's not here, have really pushed for the Commission to lead on safe use and other initiatives. Before I hand it over, I also wanted to acknowledge our chair, Chair Diana Waynu, who has also helped us to focus on our dual priorities of safety and equity. So, Commissioner Nash, thank you very much.
Thank you, Director Brown. Good morning, everyone. Thank you for joining us as we launch our first cannabis safety public education campaign. As co-chair of the Commission's Public Engagement and Education Committee, along with Commissioner Barker, we are pleased to see this campaign ready to be launched across the state. Our top priorities at the Commission are safety, health, and the wellness of New Jerseyans, whether they're cannabis consumers or not. The goals of this campaign are to prevent children from accessing cannabis products by requiring child-resistant packaging and encouraging safe storage. Keep it away, keep it locked up. To educate persons under 21 years of age about the potential effects on brain function, mental health, and potential for addiction. To provide accurate information to pregnant or nursing mothers without judgment, so that they can make informed decisions about their health and the health of their baby. To encourage seniors and others to talk to their healthcare providers about the potential risks of cannabis use with their prescription medications. To prevent impaired driving and encourage people to take advantage of delivery services which are currently permitted by dispensaries and will be more widely available as delivery service licenses are granted, and to educate newcomers to cannabis on responsible consumption. Consuming, especially with the expansion of infused food and beverage products. Consuming edibles can be a very different experience for some than smoking cannabis, and ensuring that consumers understand labeling information such as potency, serving size, and onset of effects. All of these are really crucial. Our bilingual campaign seeks to accomplish all of that. It will reach people of all ages and backgrounds through various communication channels, including digital, social media, and on-demand programming. You will see campaign messages on your way to work, to school, on more than 100 digital billboards, on highways and byways crisscrossing the state. Launching this campaign shows New Jersey's dedication to responsible legalization, emphasizing safe use among adults while protecting our youth and vulnerable populations. We want to empower you, New Jersey residents, with knowledge and resources to make informed decisions about cannabis use and encourage purchasing from the legal market, which supports union jobs and designates monies to make communities better. Thank you for your participation, and let's work together to make New Jersey's model for responsible cannabis use and public health protection. Thank you.
Thank you, Commissioner Nash. As Executive Director Jeff Brown said, the campaign is focused in several areas, and we have invited community partners to speak in those areas, and first of which is Lauren Paterno from AAA Northeast, the Senior Government Affairs Advisor. Lauren.
Thank you, Tony Ann. Thank you to the Cannabis Regulatory Commission for our opportunity to participate in this important press conference today. AAA, safe driving and safe use of cannabis is very important to AAA. We are proud to partner with the CRC and the Division of Highway Safety to provide flyers regarding the risks and hazards of driving under the influence of cannabis. The flyers are provided at dispensaries across New Jersey with each point of sale. They are available in English and Spanish. This is a Spanish version, which I have in my hand right now. The flyers really serve as a reminder to drivers that driving and cannabis is a dangerous combination. Research shows that it can impact your attention, your reaction time, your coordination, and your balance. And these are all things that we need for safe driving on our roadways. The combination of alcohol and cannabis can be even more dangerous on our roadways. So simply put, if you use cannabis, don't drive. And if you are planning to drive, don't use cannabis. Thank you.
Thank you, Lauren. And another population that we're particularly concerned about, because studies are showing that there is an increased usage among this particular group, is pregnant and nursing individuals. So we have invited Helen Hannigan from the Southern New Jersey Perinatal Consortium to speak.
Thank you, Tony Ann, and good morning. I'm Helen Hannigan, President and CEO of the Southern New Jersey Perinatal Cooperative, one of New Jersey's 3 maternal and child health consortia. Our agencies collaborate with clinical providers, community members, and healthcare systems in every New Jersey county. Our mission is aligned with First Lady Tammy Murphy's call to make New Jersey the safest and most equitable place to give birth and raise a baby. As a public health policy, the decriminalization of cannabis is an enormous victory. Fewer arrests, prosecutions, and incarcerations, along with the opportunity for expungement, provide relief to historically marginalized communities that are disproportionately affected by enforcement of old statutes. This keeps New Jersey families together, and keeping families together and communities intact ensures greater safety and stability for pregnant and birthing individuals and their babies. I am delighted to support the Safe Use campaign of the Cannabis Regulatory Commission. The campaign's clear focus on securing cannabis in locked containers outside of the reach of children, ensuring that regulated cannabis products cannot be confused with candy, and on the implementation of policies against cannabis products with unknown strength will raise awareness and protect against babies and children's ingestion. Keeping children safe begins before birth. Clinical experts, public health leaders, and communities that surround birthing people have identified do's and don'ts to guide the way. These recommendations include strategies to eliminate behaviors, foods, and the use of substances that may put a pregnancy at risk. Evidence-based guidance tells us that pregnant people should stop using some over-the-counter medications and supplements and avoid certain foods and caffeine. Controlled substances known to endanger pregnancy and cause harm to fetuses include tobacco products, cannabis in all forms, alcohol, and opioids. It is the recommendation of public health and clinical experts that around alcohol that is most aligned with our recommendations for cannabis. There is no known safe amount of alcohol or cannabis for pregnant or breastfeeding individuals to use. Experts agree today that continued research is needed to determine the impact of cannabis on pregnant individuals, their developing fetuses, and young children. And as more and more states and countries legalize cannabis products, this research will improve and guidelines will be updated. There is evidence that cannabis can cause harm and negatively affect fetal, infant, and child development, and there is no proof that cannabis is effective in the treatment of morning sickness. If you currently use marijuana and are pregnant or plan to become pregnant, you should stop using it. And if you need support, talk to your clinical team. Thank you again for the opportunity to support the Safe Use campaign. Together, we will keep all New Jersey families safe and healthy. Thank you.
An important partner in disseminating this message of safe cannabis use is undoubtedly the industry. And to that end, we have Scott Rudder, the president of the Cannabis Business Association. Welcome, Scott.
Thank you, Tony Ann. Thank you, CRC, for having me today. I'm thrilled to help kick off the state's first ever Cannabis Safe Use campaign. Today I wear several hats. I am the founder and president of the New Jersey Cannabis Business Association, the state's first and largest cannabis trade group in New Jersey. I'm also the CEO and founder of Township Green, a dispensary that will be opening up later this year. And most importantly, I'm the father of three. I got a 14-year-old, a 17-year-old, and a 20-year-old. With each of these three hats, my main concerns in helping to launch a brand new cannabis industry have been and remain health, safety, and education. As the voice of the industry, the NJ-CBA is committed to providing safe products, offering education in our dispensaries, and giving customers every good reason to buy from licensed cannabis businesses that go through a rigorous process that include quality control and lab testing. Unlike the illicit market, when the adult consumers and patients make a purchase at a licensed facility, they know exactly what they are getting. They have confidence in their product because they can actually see what's on the label. They can actually see what's on the label. When you look up, you lose your spot. They have the concept of the label, which includes important information regarding the contents of the product and that the product is secured in child-safe packaging and that their product was tested. There are no surprises, just confidence in knowing that the product was sold in a safe environment by an educated staff. Safety is paramount for all of us. Our association promises to be a partner with the Cannabis Regulatory Commission in promoting best practices for the safety of consumers and to keep cannabis out of children's hands. We will continue to provide any support we can in amplifying this message for this campaign. We understand that by equipping consumers with knowledge, we empower them to make informed choices, and we raise awareness of the benefits of buying legal. This supports increased job growth, it supports our communities, and our consumers' well-being. By supporting this campaign, we send a strong message to the entire cannabis industry that responsible business practices, focusing on customer safety, are crucial for growth and sustainability of New Jersey's growing cannabis industry. The launch of the Safe Use campaign by the New Jersey Cannabis Regulatory Commission is a pivotal moment for the cannabis industry in our state. We can set a positive example for the nation as we navigate the evolving landscape of this industry. The NJ-CBA is wholeheartedly committed to this mission and looks forward to working with the members of the CRC and our partners and allies. Thank you.
That is the last of our speakers this morning. We invite you to have some Oh, I am so sorry. I missed one of our most important partners. I am so sorry. Dr. My apologies. Dr. Diane Colello, I am from the Poison Center, New Jersey Poison Center, who's traveling also with Danielle, but I apologize. Please come on up, Dr. Colello.
Thank you, Tony, and I'll try not to take that personally. Good morning, and thanks for the invitation to speak. I'm Dr. Diane Colello. I'm a pediatrician, toxicologist, and executive and medical director of the New Jersey Poison Control Center, and we're thrilled to be partnering with the CRC on this state's first ever Safe Use campaign. At the Poison Center, of course, we understand the vital importance of safe packaging, use, and storage of substances in the home. And we commend the commitment to ensuring the cannabis users in New Jersey are educated and informed. You know, anytime a product is made more available, whether it's a pharmaceutical or a household product or cannabis, we will get more calls for poison exposures. It's just directly related to availability. And when the cases are related to adult consumers, at the Poison Center, we're often able to help them stay safely at home with a little advice and reassurance. If somebody is more symptomatic, of course, we'll refer them into healthcare. But unfortunately, in young children, ingestions, which are, you know, entirely really edible products, can have more serious consequences. The majority of these exposures are attributable to edibles that are either left out in the open, improperly stored in easily accessible places, and many are illegal candy lookalikes. With edibles, children tend to eat more product than they would traditionally because they taste sweet and they look great, right? You know, anything that looks delicious to me looks delicious to a child as well. 25 years in pediatric toxicology has taught me not to underestimate a child's ability to get something that they want to eat and eat it. And they're not going to eat one serving, right? You know, so it's vitally important that things be safely stored and packaged just to prevent them from getting access. Thanks to New Jersey's strict product regulation and sales, legal products in New Jersey are safer. Accidents only take a minute, but safe packaging on cannabis products can buy the time needed to prevent a child from ingesting that entire package. Child-resistant containers with resealable closures is one such precaution. Of course, no packaging is child-proof, and safe storage is a key component of using cannabis products safely. So in closing, I'd just like to remind all of those around New Jersey about the vital importance of safe and educated consumption. Remember, if you have cannabis products in your home or you carry them with you, make sure they're locked up and kept in a safe place out of sight and reach of children and pets. Purchase from reputable sources and licensed outlets. Purchasing products from state-certified dispensaries ensures your product is safe and the contents are clear. Keep products in their original child-resistant packaging, or if you do remove them, place them into a locked, child-resistant, resealable container or bag. And we have some of those here today in collaboration with the Poison Center and the CRC. Lastly, know who to call if an accident should occur or you're looking for information. The doctors, nurses, and pharmacists of the New Jersey Poison Center are available 24/7 to provide free, confidential information, answers to questions, and emergency support. Whether an adult is feeling sick after use, someone has questions about how to safely store products, or a child has an accidental exposure, don't hesitate to reach out to us for help. So thanks again. I'm thrilled about the CRC's commitment to safety education, and everyone at the New Jersey Poison Center is very thrilled to be collaborating in this campaign. Thank you.
Thank you to all our collaborators, all the speakers today. I wanted to thank Tony Ann Blake, our CRC Communications Director, Princeton Partners, who is working with the Cannabis Regulatory Commission on this, Poison Control Center, AAA, Cannabis Business Association, South Jersey Perinatal Cooperative. Thank you all. You know, a key facet of this is going to be using outreach, producing materials that we can then give to collaborators with the CRC to get the message out on safe and responsible use of cannabis. Cannabis Smart, Cannabis Safe. So I'd invite everybody to come look at all of the materials that we have here today. We have not only sample ads, but we have some actual sample packaging. I noted that we have some of the strongest regulations in the country when it comes to cannabis packaging, and those have been in place since day one. Packages have to be child resistant, not only before they're opened, but after they're resealed. We're going to be continuing to work on ads, work on collateral that we can then get to our organizations we're collaborating with, both state partners as well as nonprofits and other private organizations. So look for, continue to check our website for new materials and new collateral that you can share to help promote the safe use of cannabis. Again, thank you for coming today. Thank you for joining us for this important launch of New Jersey's first Cannabis Safe Use campaign, Cannabis Smart, Cannabis Safe. Thank you.